Hi, my name is Jana Jackson, and today I will be doing my biomedical diagnosis presentation. So I have patient 3, and the scenario is a woman brings her 10-year-old son, Raymond, in to see you. He's been overly aggressive and angry lately, but she has attributed to this to her divorce from Raymond's father. Last night, Raymond attended a party at his friend's house. After a night of laser tag and sleep, Raymond started shaking and convulsing. He stopped before his mom arrived, but she still wanted to get him checked out. Raymond does not really remember falling to the floor, but he does remember that he smelled a very unpleasant odor right before he went down. Now, the symptoms I have highlighted in yellow. So we have overly aggressive and angry, shaking and convulsing, and the lack of memory and being able to remember the unpleasant odor. So my diagnosis that I've come to is epilepsy, which is a disorder in the central nervous system and is characterized by a tendency of recurrent seizures. So the person may have different symptoms depending on which area of the brain is involved. If the abnormal electrical brain function is in the occipital lobe, then vision will be impaired. And muscles are most commonly affected. But for this scenario, the anger is dealing with the amygdala, the loss of consciousness is dealing with the pons, loss of balance, the cerebellum, and the odor is the parietal. So again, the evidence as shown from earlier, overly aggressive and angry, shaking and convulsing, and doesn't remember falling but remembers the odor. A little bit more about epilepsy. It's a disorder of the brain's electrical system, and abnormal electrical impulses cause brief changes in things such as movement and behavior, and it's also known as the seizure disorder. And it causes include genetics, brain conditions, injury, developmental disorders, head trauma, etc. So about 200,000 new cases of seizure disorders and epilepsy are diagnosed each year. Having epilepsy does not mean one cannot live independently or happily. You can, because those with epilepsy who have good health and whose mental faculties are not affected can live independently well until adulthood. And about 70% of patients can successfully manage their epilepsy with medication, or if it's like that, then they have to seek other options like surgery. Treatments, again, medication or surgery if it's really bad, and usually an anti-seizure medication is good. And for the error of communication, the nerve cell activity disturbs the neurons in your brain, causing it not to properly send the correct messages through every body since they have been distracted. These things cause you to experience abnormal behavior and sensations, including the loss of consciousness. And professions that deal with this are child and adolescent psychiatrists, emergency physicians, how do you say that?
Epileptologist?
Yeah, epileptologists, I'm sorry. I really just cannot pronounce it, but I know what I'm talking about. Family physicians, general surgeons, and etc. And that is the end of my presentation. So for his symptoms, the anger is dealing with the amygdala, which is in this area of the brain. The loss of consciousness is dealing with the pons, which is in this area. Loss of balance, the cerebellum. And the odor is in the parietal lobe. And then for the loss of sight, vision, it will be in the occipital lobe.